Would you like to heal your eye conditions? The Western medical system does not teach you how to heal your eyes but will only offer options such as medication, eyeglasses or surgery. However, these treatments do not offer permanent solutions but rather temporary relief that will immediately decline over time, forcing you to endlessly book into futile appointments that will cost you a lot of money. Keep in mind that optometrists, ophthalmologists and GPS can earn up to $1/4 to $500,000 per year. This suggests that they do not care as much for your health as they do for their own earnings, and the fact that they do not propose a long-term and viable option for eye health is seriously questionable. In spite of that, if you do not pay for their services, you will not receive them, which means the poor have most likely found themselves in a predicament and the rich are no better off because that system does not care for its patient but rather for the patient's money. The relationship between eye muscles and eyesight involves how the muscles control eye movements and focus, which directly impacts vision clarity and movement. Eye muscles, also known as extraocular muscles, work together to move the eye in different directions, allowing for a wide range of visual fields and focusing on objects at various distances. These muscles are controlled by cranial nerves, and any damage to these nerves or the muscles themselves can affect eye movement and, consequently, eyesight. Conditions such as cranial nerve palsies, myasthenia gravis, multiple sclerosis, stroke, and other neurological disorders can impair the function of eye muscles, leading to difficulties in eye movement and potentially affecting eyesight. For example, 6th abducens nerve palsy is a common form of cranial nerve palsy that can cause problems with lateral eye movements, impacting vision and the ability to focus on objects. Additionally, the proper functioning of eye muscles is crucial for maintaining binocular vision, which allows both eyes to work together to provide depth perception in a clear, single image. Any impairment in muscle coordination can lead to conditions like strabismus, where the eyes do not align properly, causing double vision or reduced vision quality. The relationship between eye muscles and eyesight focuses on understanding how the coordinated movement and function of eye muscles contribute to clear and effective vision, and how disruptions in this coordination can lead to various visual impairments. But if you ask an optometrist if eye exercises will improve our vision, you will receive a resounding no. Eyeglasses, contact lenses and eye surgeries are a brick in soft mud. The brick represents the sight and the mud represents the eye muscles. You can use eyeglasses and surgeries to make that brick, but eventually the mud will bury the brick, but if the mud is made hard, the brick will not be buried and will remain in sight. The system I will describe will teach you how to make soft mud into hard mud. So to begin, we must first discard the optical medical system and begin an entirely new system that will take effect immediately upon execution. The westernized optical medicine system may serve a good purpose, to receive a visual diagnosis, although in most cases, I presume that diagnosis won't be made until visual symptoms are well established. The diagnosis will allow you to find imagery of that condition, which can be used to determine which muscles are weak muscles. Alcohol and cigarettes must be a life habit that is ceased. However, those two things are not the core reason for eye issues, but ceasing consumption immensely helps with visual improvement. The primary cause for eye ailment is muscular weakness, so it is imperative to address this component with indefatigable methods. The primary method is eye palming, proposed by Dr. Bates, who was branded a quack by the mainstream medical industry and scientific community for reasons that should be obvious. William Horatio Bates had the highest qualification in visual optics. He was an ophthalmologist that bit the hand that fed him, and to this day is scorned as pseudo-snake oil by a host of ineligible peasants. Pressing on. Place pressure on both eyes using your hypothenar. These are the large muscles found at the base of your little phalanges. They fit perfectly on your eyes. Hold the pressure starting at 1 minute and work your way up through 1 minute increments. The timing is up to you. The longer you do this, the better the results. I find 10 minutes is a good time frame. While placing pressure on your eyes, slowly look around. This movement stresses the eye muscles more so than simply looking around with naked eyes. Do not aimlessly look around, rather slowly look around, pressing and holding your eyes in various positions, creating specific strains and movements. While placing pressure on your eyes with your hypothenars, perform eye exercises as well. Common eye exercises are eye rolling, look left to right, look up and down, *, look top left to bottom right, using vice versa. These are basic patterns that are good at hitting basic strengths and are easy to remember. But a more complex pattern that is easy to remember is to draw letters with your eyes. You can write your name by moving your eyes in the directions of each letter. You can also just write phrases. Lowercase is easier and capitals are more trying on the eyes. This movement of the eyes drawing these letters reinforces acute dexterous eye movement. Writing your name 10 times is tiring on the eyes, but in return reaps greater strength. The pressure created by your hypotenuse promotes blood flow, which in turn promotes eye reparation. Obviously, eye reparation will conduct eye healing, a natural function of the body used to repair something as simple as a pin prick. So this is a quintessential method required for optimum eye healing. The hypotenuse applies a general pressure to your eyes, which is very universal, but if you want to apply a more stringent and direct pressure, you can use the distal phalanx of your index and middle finger. By looking in one direction and applying direct pressure, you can create a more intense strain on the specific eye muscle for looking right, left, up or down. Releasing pressure and looking straight ahead relaxes the eye muscles. This technique is similar to a yoga body hold. If you hold consistent and strong pressure at an area on the eye for a long time, say for a count 100, once you release your fingers or palms from your eye or eyes, and look, your visual field will be unusually bright and vivid. It's almost like the eyes are soaking up light. This vivid brightness fades, but each time you do it, the eye adopts the ability to see clarity for longer periods of time. The pressure creates a strain on the eye muscles, much like a weight creates a strain on your biceps. That strain simply strengthens that muscle. Strong eye muscles create optimum eye function. REM sleep, rapid eye movement, is the body conducting nocturnal eye exercises. To conclude, creating a routine and a set time each day for doing this will increase eye strength, allowing the eyes to endure hardship easier and become less tired. Tired eyes are the eyes that are prone for eye conditions such as strabismus and myopia. The two most common eye issues. Use your phone's 10 minutes timer, do 40 repeats of each eye pattern, and then write your full name in capitals. Give times while placing pressure on your eyes with your hypotenuse. Once in the morning and once in the afternoon will suffice. Feeding the eyes is also very important. Without adequate food, the eyes cannot repair appropriately. It is suggested that carrots, olives and grapes are excellent foods used to nourish the eyes. The juice and oils from these foods are also excellent sources. While we sleep, the body zones out and goes into repair mode, repairing the eyes also using the food we ate during the day. Tea is known to contain nutrients dedicated to eye health. Green tea, chamomile tea, and just about any herbal teas containing ingredients such as ginseng or ginkgo biloba that you can obtain will aid eye health. Basil, mint and sage are known to be visual remedies and can be used in tea also. Another treatment, if you make your own tea using loose leaves, is the steam. A small kettle that emits a good stream of steam from its small spout and kettle lid hole. This is very pure water that is infused with finest nutrients of the tea ingredients. This steam contains volatile aroma compounds and esters of whatever leaves you are boiling. Mint, jasmine, sage, etc. Once the water is boiling and you can see the steam, from a distance look into it, but not so close that it burns. This steam should smother both eyes. An induction kettle can hold a steady boil at 100 degrees. Life's no longer about enjoying an exotic platter of delicatessens or experiencing an array of mystique herbal aromas, but food serves only one purpose, and that is optimal survival. Like using the hypotenuse, why not use food and eat a strict healthy diet from day to night for a lifetime that consists only of fruits, veggies, herbs and nuts? The human body has a material relationship with botanical foods similar to the relationship it has with air that most do not grasp. If this relationship is realized and utilized, physical deficiencies can potentially be rectified with physical efficiencies, the physical deficiency being the ailment and the physical efficiency being the food. Native ailments might be permanent, but that is not to say that they cannot be relieved if not replenished 50% minus 100%. An example, the eye cornea is mainly made out of collagen. Studies have shown that virgin coconut oil (VCO) can speed up wound healing by decreasing the time of complete epithelialization and increasing levels of various skin components such as collagen and glycohydrolase activities. Gently applying coconut oil to the whites of the eyes and blinking the oil into your eyes is most probably a very safe method for promoting eye health, especially for those that suffer eye opacity. This could also be done with olive oil or grapeseed oil or jojoba oil. You can use a pipette to drop the oil into the eyes. While ingesting the oils would nourish the blood and essentially supply the eyes internally, applying it to the eyes would nourish them externally, possibly creating a hastier recovery. Be sure to apply the oil with clean hands and gently to avoid irritation. Don't use essential oil unless you are sure it's okay. Oils like cinnamon oil would damage the eyes severely. There are foods that do harm to your eyes, so I would not recommend applying cheese. These harmful foods are meat and dairy. These foods contain bad bacteria and toxoplasma. Toxoplasma is a blood parasite that is known to eat the eyes, causing eye issues such as floaters. Animal meat contains cholesterol, unlike plants which contain almost none. Cholesterol is responsible for causing eye cataracts as it tends to harden the body universally. These foods should be discarded with cigarettes, alcohol and the optical medical system. Decades of eating meat and refined foods is going cause an overload of waste, toxins and parasites that dwell in the human body. One is these nasty waste substances is blood plaque, which sticks to the insides of arteries and veins, blocking and slowing blood flow. Lime juice will break blood plaque and onions will kill blood parasites, but it takes years of body detoxing in order to rectify the damage caused. Another way to do a holistic body cleanse is to not eat a single thing for 4 complete days. The only permissible consumables are water, tea, coffee and other liquids minus obvious and nasty liquids such as energy drinks, etc. Eyeglasses act as an inhibitor for progress and should not be used adjacent to this system, but if you require them while you are building your eye strength, then use them sparingly or only when necessary. This eye healing system is pertinent to reality and is very practical. You will see a drastic change within the year, but tracking your visual acuity is not easy and noting observable change in your eyes might be minimal, but that is not to say the processes are ineffectual. The type of system I am describing is not desirable for a doctor because it won't create a repeat customer, but it will save your money and your eyes if you willingly commit to it. Putting aside time to do this may seem like a daunting and wasteful task, but eyesight is the primary sensory system, which makes this a primary task. Unless you do not value your eyes, then this system would seem generic at best. However, regardless of how we feel, we actually spend the majority of our day doing time-wasting tasks. Reserving only half an hour for this precious system reaps untold benefits. 1 year's worth of effort feels like only minutes sacrificed, just like a 2-week vacation feels non-existent in 2 years' time. It's no different than committing to going for a run, eating good food, reading a book, playing an instrument or singing a song. You simply need to see the reason and the logic as to why we would do these tasks that almost anyone indoctrinated by science would call quackery. Muscles are dynamic in omnidirection, that is, everything the mechanical is not. Eyeglasses, contact lenses and surgeries are all mechanical interventions that only slows if not destroys progress. The eye muscles are the power of sight, they are not sight. The eyeball is sight, and once you have the power of sight, you will have sight. We all want to see without effort. We do not want headaches, strains or sore eyes when doing something as monotonous as seeing something. Rest and relax is comfort. Seeing should be comfortable and relaxing, it should not be a strenuous task. Weak muscles do not relax, nor are they comforting. Only strong muscles can relax and provide comfort. The quintessential components to my program are exercise and food. Unless you stringently adhere to this syntax, you will not see positive change. If you don't make a change, there will not be a change. Once you understand that, you can do it and expect improvement. Best of wishes to you.